Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. Our programming Monday, Wednesday, and Friday is sponsored by Fieldstone Memory Care on Bainbridge Island. Fieldstone offers innovative and compassionate care that's worth the wait. You can call 360-271-2530 to schedule a tour and see Fieldstone's beautifully appointed apartments for yourself. Fieldstone Memory Care on Rolling Bay. And today we are very happy to welcome Jessica Guidry, who is the county's new equity program manager. Jessica, very glad to have you here.
And if you don't mind, Reed, I would love to just, I guess, give folks an update on my background. Yeah. I've been at the Kitsap Public Health District now for 13 years. So this position started in August, the equity program manager position. But for 13 years, I was the health district's public health, emergency preparedness and response program coordinator, and then manager. So my background is in public health, emergency management and response. And there's one thing when it comes to emergencies or disasters is that often inequities get elevated and exacerbated, especially, in communities. And I guess, Reed, one thing I have to ask is, I've got some background information I'm happy to share in terms of what public health is and what the health district is first. I don't know if folks are interested in hearing about that first, and then I can
Sure.
jump into, and what I'll do, y'all, is I'm going to share some slides and we'll go from there. Thank you. So I wanted to share this definition of public health. It's from the CDC Foundation. And it talks about how public health is the science of protecting and improving the health of people and their communities. It's achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. So really with public health, our patient is our community. We don't provide necessarily direct services one-on-one like healthcare does, but really we see our patient as everyone who lives in our county, who visits our county, and our services are primarily in terms of policy. There's some enforcement, and I'll talk a little bit about that, education, and some other things as well. And I know, at least in the before times, before the pandemic, I think folks would sometimes confuse us with healthcare. So as I mentioned earlier, it's very population health centric. We implement community-wide strategies to promote health and minimize and eliminate disease. So that might be, for example, having like a healthy eating campaign where you might see information in various places, or when we work on policy to help address smoking in public places and things like that. And a lot of it is public education policies, assuring that we have a healthy environment, and we have a whole environmental health division, and I can talk a little bit about that. And then also we provide some technical assistance to healthcare, especially when it comes to infectious disease. Now on the flip side, when you look at healthcare, it looks at individuals, it provides direct patient services, and it looks at diagnosing, treatment, recovery, and disease prevention. So there is some overlap when it comes to prevention. And you will see, though, that there are healthcare organizations that do community education as well. So there is a nice overlap between public health and healthcare. And in the US, public health is done, so it can be done by nonprofits and that do educational work. But primarily when it comes to government, you can see it done at the city, county, and state level, and then also at the tribal level, and also federal government as well. So like the military, for example, has their own public health system. So at the health district, we've been around since 1942, and our office is in Bremerton. I don't know if you all have been to the Nordics Government Center in downtown. That's where we are. We are governed by a public health board, and it's currently composed of 7 county and elected and city elected officials. The composition of the board is eventually going to change based on some recent state laws. And from Bainbridge, I believe we have a Bainbridge City Council member who represents Bainbridge on our board. We are a special purpose district, so we're not a county department. And the only reason I mention that is because we have our own administrator. We have a health officer who's basically like our chief health officer, or our chief science officer, excuse me. And they report directly to the Kitsap Public Health Board. We have a great relationship with the county government, but we are not a department of them. Whereas in some other counties, they are a county department. I say here that we have around 100 employees. I think we have about 120 something now. Several of them are provisional employees that are helping us with our COVID-19 response. And our employees are divided into 3 divisions. We have our community health division. So that's where our communicable disease investigators and nurses are, our COVID program. We have an HIV program, chronic disease prevention, our epidemiologists as well. So they're all in the community health program. With environmental health, that's where we have programs that look at on-site, so septic systems and sewage systems. We have programs that look at food and living environments. So they inspect our restaurants, pools, places where they serve food. They also respond to calls about things like bats and smoke and a variety of things. We have a solid hazardous waste program in environmental health, and also a water quality program, which is called our pollution identification and correction program. And then with administrative services, that's our backbone in terms of IT, admin, human resources, accounting, finance, facilities, and whatnot. But we do serve the whole county, our entire county. So what is our mission? So it's a very lofty, very huge mission, I think, but we really strive to prevent disease and protect and promote the health of all persons in Kitsap County. And we have a variety of guiding principles, but I want to emphasize the one that I've highlighted in yellow, and that's about equity. That we believe all Kitsap County residents should have an equal opportunity to live healthy and safe lives. And I've been asked in the past about the difference between equality and equity. And some people may see it as semantics, but when we look at equality, we're looking at giving everybody the same amount of resources, whether it's the same amount of time, same amount of whatever the resource is. But with equity, we're looking at eliminating barriers so everyone can have their best opportunity to have a healthy life. So it's about eliminating barriers, not necessarily giving everybody everything, but there's some groups who might need information that's translated, or they may need different strategies if they don't have access to transportation. So it's really looking at where people are, if they have barriers to living their healthiest lives possible, and how do we address those barriers? And that barriers can be economic, policy, a wide range. And then we've got some other great guiding principles as well. When we look at the definition of health, this is from the World Health Organization. We look at it in a very holistic sense, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I think this really also is really in line with how in public health, yes, we have to react to health crises like a pandemic. We also really strive to try to prevent them in the first place and help people live their healthiest lives possible. So in this next slide, I'll talk a bit about what affects health. Researchers, there are a lot of researchers who support the concept that health is impacted by more than just access to healthcare. So it's impacted more than being able to see a doctor or having access to medicine. And you'll see here, and this is a model that was widely looked at in public health. And some people may disagree on some of the numbers, but what these researchers around have identified is that social and economic factors are a primary driver of health. Where you live, what access to services you have, your experiences with discrimination, whether it's racism, sexism, all the other isms, income, employment, education, all of that really impacts health. Yes, the physical environment does as well. In public health, you'll hear us use the term built environment. So that's, for example, access to sidewalks, parks, so the ability to physically enjoy your space so you can get exercise and be healthy. Health behaviors, I know a lot of folks emphasize, well, people will only be healthy if they exercise more or eat more fruits and vegetables. That healthy behaviors is definitely a contributor, but then we look at, well, can people have access to fresh fruits and vegetables? Are they more expensive? Or if you're in a place where they don't have a lot of supermarkets and they might only be able to get vegetables at like their convenience store, do they even have a good variety? So we've got health behaviors and then clinical care as well. So again, that's access to healthcare. And that's also where the US spends most of our money, is in the healthcare system. And this just shows you what in a bit more detail. I'm sorry that this is so busy, but when we talk, for example, about how 30% of health can be impacted by health behaviors, that's things like tobacco use, diet and exercise, alcohol and drug use, and sexual activity. Clinical care is not just access to healthcare services, And I know on Bainbridge Island, this is a big discussion over there, but also the quality of care. Do you have access to the services you need? Are you getting treated in a way that's fair? And so on.
I just wanted to jump in and ask about the difference between social and economic factors in clinical care, because it seems like those might be very interrelated.
It's a great question, Reed. And when we think of clinical care, it's about, do you have access to a doctor? And you're right, a lot of that can be social or economic. Do you have health insurance, for example? Do you have enough providers in your community? But then also, do you have providers who reflect the community? Whether it's, providers who look like their community, who are trained to deal with issues that the community is facing, whether it's like having providers who are familiar with like LGBTQ health or with women's health. So I think there's definitely an overlap there. And then also with clinical care, with medications, are there pharmacies in the area? And often, or at least in my experience, you often see more pharmacies in the community than you do actual clinics. But yeah, I think there's a definite overlap, because also to get access to clinical care, there's the issue of transportation, whether or not you come from a culture or a family that believes in getting healthcare, or do you wait for the last minute kind of thing? So I think there are definitely overlaps in one's social and economic factors and their ability to get care, and also how they're treated when they get care as well. There has been research that's looked at how racism in when getting healthcare, and it's not overt racism what I'm talking about, but it might be, for example, providers acting a certain way or having certain beliefs about a certain group based on their training and life experience, when that's not really what the group feels or thinks about something. So there's definitely overlap. It's a great question. And then with physical environment, that's the housing and transportation I mentioned, air quality. And this, nowadays also with with fire and with smoke. So I mean, that's also becoming a big concern also. The fancy thing there. But this is a model from Dr. Tom Frieden, excuse me, and he was with the CDC. He was their director a few years ago. And what this shows is just how important it is for us to address social and economic factors for us to help address the health of a community. So you'll see here that socioeconomic factors are the bottom. And on the left, you'll see there's increasing population impact. So the more we address socioeconomic factors, the more people we can help in terms of their health. Whereas when you go up this pyramid, on the top of the pyramid, you all can see is counseling education. That is a one-on-one intervention or service, and that affects a smaller amount of people. So, and it takes more effort to do that versus addressing things on a larger scale. So in public health, that's one of the reasons why we and the previous slide, we really do look at socioeconomic factors. Also, and this is where race comes in. I'll talk a bit about that more later, but addressing those because it's interrelated. And as we talked about earlier, in terms of access to healthcare, your stressors based on your life and what has happened to you and how that impacts your health. So this is really important for us to consider. So I want to read this out loud because I think it's really important. But research unequivocally demonstrates that a history of individual and structural racism spanning generations has denied opportunity to people of color and has impacted their physical and emotional well-being. This is true across America and here in Kitsap County. And what I can do, Reed, is I'm currently compiling a list of studies that I can definitely send your way if people are interested in seeing the studies. I mean, there's been a lot that looked at racism and maternal health, also the health of infants, also heart disease. So I'm happy to share that. But there has been, public health as a discipline has been looking at racism and health for at least 20 years. It's not a new concept for us, but it's important for us to address. Even though Kitsap County might not be as diverse as, let's say, King County, we still have diversity, even if it's not as much as King County's. And I've heard a lot of people in public health and in other sectors say that if we can address racism, then through that work, we can also address other forms of discrimination. where we talk about sexism, ableism, ageism. Out of a lot of the forms of discrimination, racism is, I think, this is in my opinion, I've heard others say this too, racism is one of the most difficult to talk about because of our history and because it's such a personal, political, and in community just issue. So it is important for us to address. And we have heard stories from our community members who have shared that they have experienced racism. And to us, that's important, in addition to the research that we've seen.
Yeah, I'm also thinking that there's a possibility that in a more homogeneous community, awareness of diversity and the differences that different cultural backgrounds might bring would be lessened. And so there might be a sort of a blindness to racism or sexism that or other things that might not show up in a community more diverse like King County. Communities of color are larger, more likely to maybe be able to there's an awareness, and so the response might be a little more educated.
I think you're right, Reed. And I've been reading this book called The Conversation, and I'm happy it's by Dr. Robert Livingston. And it's interesting because he talks about how racism is not, so when we talk about racism, it's behavior. And polite people can act in ways that are racist unintentionally, but it's through not knowing, for example, that, if they use, like a term that some communities may feel offensive. If they don't have exposure to those communities, they may not know that that is offensive. And same with wearing costumes representing different cultures. So racism is a behavior, and yeah, and I guess I'll say with that, but you're spot on. So we use this. This is a definition that I've looked at, and as an agency, we're going to be looking at other definitions to see if there are more that we think, I guess, better resonate with our work moving forward. But this is from the past president of the American Public Health Association. And it looks at how racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, so which is called race. So this system of structuring opportunity and assigning value, it unfairly disadvantages some individuals and communities. It unfairly advantages other individuals and communities, and it saps the strength of the whole society through the waste of human resources. So it looks at the lack of fairness and basically preferring and giving more benefit to one group versus another. And you'll hear terms like personal racism, institutional racism, structural racism, and all of that. But it really looks at this structuring opportunity and assigning value. So next, I'm going to share some data, and the reason I'm going to share this data is that this data is also mentioned in our declaration, which I'll talk about in a little bit. But it does show you that even in Kitsap County, even if we're not as diverse as some other communities in the country, we still see a difference of health outcomes based on racial and ethnic groups. So when looking at, and this lecture right now is looking at socioeconomic status, when looking at like median household income for American Indian, Alaska Native, Black, Hispanic, and multiracial households is at least $10,000 below that of white non-Hispanics. When we look at education, high school graduation rates are at least 5 percentage points lower for Black, Hispanic, Native Hawaiian, Pacific Islander students compared to white non-Hispanics. And children entering kindergarten ready to learn is at least 14 percentage points lower for American Indian, Black, Hispanic, and Native Hawaiian and other Pacific Islander children compared to white non-Hispanics. I mean, so this is things like, are children able to identify like their numbers? Do they have concept of the alphabet? Things like that. So even looking at kids as young as as 5. And looking at healthcare access, approximately 7 out of 10 Hispanic and Black women who are pregnant access prenatal care in the first trimester, compared to about 8 out of 10 white non-Hispanics. And that's really important. Getting that care in your first trimester is really important. And this is also something that I just personally find really devastating, is that non-white babies are nearly twice more likely to die in their first year of life compared to white non-Hispanic babies. And life expectancy for Black non-Hispanics is 5 years less than white and non-Hispanics. And there shouldn't be a difference, biologically speaking, look at it from the biology standpoint. And here's some more information in terms of how people of color may be at higher risk for experiencing chronic diseases, adverse behavioral health, and poor health outcomes. So you'll see here about, adults reporting activities not limited by poor physical or mental health. 64% of whites responded. This is from a survey a couple of years ago, compared to 37% of people of color. When we look at Hispanics, respondents, they may be at higher risk for experiencing challenges associated with economic related social determinants and healthcare access. So this looks at, again, the starting prenatal care in the first trimester. And then when we look at our LGBTQ youth, lesbian, gay, bisexual, transgender, queer youth, they may be at higher risk for experiencing adverse behavioral health. So even when looking, and this is, I believe, from the Healthy Youth Survey a couple of years ago, eighth graders, when looking at eighth graders reporting having an adult to turn to when they feel sad or helplessness, 72% of eighth graders who responded said that they were straight had access to an adult, whereas 40% of LGBTQ youth that were responding in the eighth grade reported having someone to turn to, an adult to turn to. So we're also seeing health disparities when it comes to COVID, and this is something that we've seen across the country, but it's also happening in Kitsap County. COVID-19 infections have been more prevalent, so about 33% of cases in communities of color compared. And when you consider the fact that communities of color make up about 25%, so maybe roughly 1 in 4 individuals in Kitsap County is a person of color, but you see more cases proportionately among people of color when it comes to COVID. You also see that COVID infections have been more severe among our neighbors of color compared to the rest of the population as well. There is no biological reason for this. You'll see also when it comes to race and ethnicity and case rates. Now, granted, this chart is a little bit old, but you'll see here that when it comes to cases, we saw a spike, in August among individuals who identify Hispanic and Latinx. And even through February, and this was August of last year, and we did see more other non-whites also as well. And then when you look at the percentage of cases, for the whole pandemic, or say since March 2020, those identifying as Hispanic or Latinx had a higher percentage of cases compared to the estimated. So there are disparities. And one of the things that the health district has been doing, and I can talk more about that later if folks have questions about it, is we are reaching out to organizations that serve various communities of color, people with different abilities and whatnot, to hear from them and to see how we can work together to address COVID. And we've got a vaccine equity collaborative I can talk about later if folks are interested. So also we look at vaccinations as well. So compared to our white residents, COVID vaccination initiation rates are lower proportionately among Black and Hispanic communities. But that said, still, more white individuals in Kitsap County are unvaccinated than Black or Hispanic. But this is really looking at things from a proportional perspective. But notably, the highest rates of COVID vaccinations are among Native Hawaiian, other Pacific Islander, and American Indian, Alaska Native communities as well. So we are seeing differences in terms of who's getting vaccinated. And we've gotten questions and concerns from community members who distrust healthcare because of their community's experiences with healthcare that have gone generations, but even more recently. So racism has been a factor with some folks that we've heard from in terms of their interest in getting vaccinated, their trust in the process, and understandably so. So last year, our leadership at the health district issued a call to action, and this was, I believe, about a month after George Floyd's death. And in this call to action, it was an open letter to our community. And it really emphasized that the health district, and I'll just read a couple of points from this. that we join in solidarity with our community partners to build a more equitable and just society. The pain felt across our country is deep and real. Healing can only come with meaningful change, and we all have roles in creating that change. And it refers to the disparities that we see in Kitsap County and that are seen also across the country. And it really, this letter thanks the community members and organizations who are already striving to make Kitsap County a safe and healthy place to live, work, and play. And I'll talk a little bit about our equity page where you can see this letter. So that happened last year, either May or maybe it was June. So across the country, communities are declaring racism as a public health crisis or emergency. These declarations are just a first step, but they're an important first step in advancing racial equity and justice, and must be followed by allocation of resources and strategic action. And it's exactly the allocation and strategic action that I'm going to be talking about, and that what my position focuses on. So I checked the American Public Health Association website. They have a map that shows how many communities across the country, and including states as well, a state government, have declared racism as a crisis or emergency. And so far, it's more than 217, because our declaration is not included in that, but we have submitted it to be added to their map. And at the time, 7 declarations were listed on Washington State. And again, these were organizations who reached out to the American Public Health Association. Hey, we've got a declaration, here you go. But even if you look here, well, yes, of these 7 counties, 6 out of 7 are in Western Washington, but they range in size. You have Jefferson County, King County, Snohomish, Spokane, Tacoma Pierce. They have a city county health department, Thurston and Whatcom counties. So this is not something unique. This is something that has been going on across the country. And in terms of, and this is going more towards Reed, what you were asking, what you were talking about. So the resolution came about. So this was basically a call from our community members. We had been, talking about what do we do about racism, but at the time we didn't have any sort of dedicated program to address equity. Several of our programs or departments do address equity in their work, but there wasn't a consistent agency-wide effort. And it was through our COVID response and talking to community members where we were flat out asked, hey, I know you guys want to work with us on addressing COVID, but what about racism? And where does the health district stand on that? And will you declare racism as a public health emergency? So hearing that, we talked about it here in the health district, and we drafted a resolution. And we got feedback on that resolution from both the Suquamish tribe and the Port Gamble-Slalom tribe. The first draft, I believe, was also shared with certain community groups, including this Vaccine Equity Collaborative I mentioned to you before that the health district helped found. It is chaired by Tracy Flood, who is the president of the NAACP Bremerton chapter. But also there are individuals in that group who are from Kitsap Immigrant Assistance Center, Peninsula Community Health Services, disability advocates, various organizations serving communities of color, also lower income folks. We've got some folks from, I think, Bremerton Housing Authority in that group. So it's a wide range of individuals. Folks from, I believe, I think Bainbridge Prepares. So there's some Bainbridge organizations that are also included in that group. The first draft was also shared with the Erase Coalition, and that is a countywide, Erase stands for, I believe, Equity, Race, and Community Engagement Coalition. And we got lots of feedback from these groups. We then shared it with our Public Health Board Policy Committee, which I think has about maybe 3 individuals. They gave some, they reviewed it, and then we did some more editing, and we got some feedback again from community partners. Then this was discussed at our April Public Health Board meeting, and this was April of this year. And as a result, we got some more input, and we gave the final draft and presented it at the May meeting, so just a month after the board discussion, and then it was passed. And this also this shows the timeline from a different perspective, where on May 4th, the board passed the resolution. On June 15th, the health district posted, the job posting for my position. I got selected in August. And I've been working on this, but to be honest, I've also am currently in transition. I'm still a preparedness manager until My successor starts on October 11th. I'm also filling in as our communications coordinator, public information officer, but so far I've been able to do some outreach, and I'll talk a bit about the work I've done so far. But by the end of the month, I'll be able to really dedicate my time full time to this work. And this is something where this position is meant to be full-time equity, not split between programs. This is a department now. It is not combined with any other department. It is a standalone department, just like how IT, communicable disease or whatnot. We have our own budget. We have one staff so far. We may have additional, sometime in the future. We have a program now. And I've been drafting a work plan that will have key milestones, and that I'll be reporting to our public health board on, and to community organizations who just want to see what I'm up to, what the health district's up to, and what our plans are moving forward.
Well, definitely keep us in the loop. We'll be glad to learn as you learn.
Yes, and definitely read, and I'll talk a little bit about this also, but I mean, a lot of the work that I'm focused on is building the foundation. So there's a lot of work we have to do internally. And actually, I'll move to that, but this shows you what the resolution looks like, and it talks about, I'll just move on to that. So what this resolution does, it has like 5 buckets of work, and you'll see that 3 out of the 5 buckets are internal. So one of the first things, well, not one of the first things, but one of the big things that we have to do is review our policies, procedures, and programs through a racial justice and equity lens. So that means that we need to choose a list of questions, and there are a lot of them out there that we can ask ourselves in terms of, whether our programs, are there barriers to receiving our services? How do we break down those barriers? So it's a matter of us finding those questions and asking those tough questions, and then figuring out how we're going to address any of the gaps or barriers that are identified through this analysis. And every program, and we've got several at the Health District. I can't tell you the total number off the top of my head, but every year we have work plans that have activities, deadlines, and performance measures. Moving forward, we will have to include activities that address equity in all of our program plans. Also, it's not, while we have a lot of work to do with the community, we have to really look at equity and train ourselves here at the Health District. And we have a lot of staff who are very interested in this work and are doing this work, but it's also having common training. So we have a common language to talk about this, and that we also build a safe environment so folks can talk about this, because it is a very contentious topic. And I have colleagues who don't understand what I do, even when I explain it, and who have concerns about us having anti-racism training. And folks have they're entitled to what they believe in, and so it's a matter of coming together as an organization to address concerns, but also we have to have training on anti-racism, cultural competency, and health equity. And the resolution addresses those 3 topics in particular. But we also have to apply strategies, and I know we do that, but there could be also ways we could do this better or more in terms of recruiting and hiring a workforce that reflects the population we serve. But when you look at our data, and on our website, we have the demographics of our staff. They do reflect quite nicely with the demographics of our county. But also not only do we have to do all that, we have to have the infrastructure for it. So it's actually allocating resources, like I was talking about earlier. You have to allocate resources and have strategic action. So with resources, it's hiring a staff person to do it, not just making it a responsibility with someone who has 10 other responsibilities. I don't have 10 other responsibilities, but having a dedicated person for it, having a program, having a budget. So that's really important. And then also having an internal committee where we can discuss this. So it's not just my role to do the work. Everybody at the Health District is going to have to do this work, but as the program manager for this, I have to coordinate, engage people, get input and whatnot. Community partnerships are really important, and this is the most vague out of the buckets, which it's not always going to be this vague, but you'll see here that in that bucket it talks about co-creating solutions to address structural inequities. And as I talk with the community, and I get direction from our public health board and our leadership, we can figure out what structural inequities we want to address. And racism is definitely one of them, but how do we address that? That's something that we're not just going to come up with on our own. It's definitely something we need to partner with organizations with, and see what our community is interested in as well. and then promoting policy and system level changes, which we hope can then make, which will, impact people at the individual level. And then our public health board also has tasks that are assigned to them in terms of having government relationship with our neighboring tribes, and then standing for nonviolence and inclusion and for environmental restoration. So those are the buckets. We do have an equity page. So a lot of the stuff that I've talked about, you can actually see on the webpage. It's got our reports, it's got our data. If you want to see a resolution, or the even the recordings of the meetings where they talked about the resolution. We did a health disparity report in 2017, which you can see. Excuse me. And then you can see our demographics and how they compare to the counties. Yeah, this talks a bit more about it. I'm just going to skip that. Yeah, I'll skip that because I would love to engage more in conversation. But in terms of what the equity program looks like, so I mentioned equity committee. I'll also be looking at staff training. Really need to make sure that we find a training that, first we need to be really clear on what our goals are for the training and what our parameters are, and how we want the training to happen. Then it's a matter of then finding the right trainers and how that rolls out, considering we have over 100 staff members. And we have this kind of hybrid telework in person working at the health district. So how do we address that? Definitely looking at policies and procedures and finding those lists of questions, adopting, with our leadership's approval, adopting a list of questions, and then prioritizing which policies we address first. And even with services, I mean, this can even be things like the forms that we use when people might get some services, like direct services from us, like if they get a vaccination at the health district eventually, or if they receive services like from our parent-child health program, or other services. So looking at various things that we do. Also looking at workforce retention and recruitment. Are there, when we have a job posting, are there groups that we should be sending our postings to that we don't currently send to? Do we need to consider, really consider like some of the educational requirements? Is that an unnecessary barrier? I think our staff does really carefully look at what our requirements are, but that could be something that we readdress. And then also the partnerships is really important. There are a handful of folks who are addressing diversity, equity, and inclusion in Kitsap County, and where we're coming together and finding each other and networking, but also talking to folks who are already doing this work. So I hope, for example, to reach out soon to the Bainbridge Island, the city's diversity, I think it's a task force. I think the acronym is REACT, but there are groups out there already doing this work, so we can build bridges and not have to duplicate efforts. So with that, and I'm going to stop sharing my screen. What I'll do, Reed, is I'll send this to you, and I'll have my contact information. And I need to update my phone number as well because I'll be changing that. But I'm going to go ahead. I'm also moving offices too. But yeah, that's the history of the program. In terms of things that I've been working on right now, looking at this equity committee, building a charter. We have a lot of staff who are really interested in this work. So it's really being thoughtful about what this committee, what the scope is versus my scope versus their scope versus the scope of the health district. Building these bridges, also, working this work plan, creating what we call also a logic model. So it's not just enough for me to say, these are all the things that I want to do, but we also need to figure out how are we going to evaluate our equity program. So what kind of data do I need to be sharing with do I need to share with our staff, with our community about what I do, and how does that data get shared? Also doing that networking, so building an inventory list of all the groups working on that. That's something I've been working on as well. And then talking with groups as they're interested to hear about our declaration. So anyway, I've done a lot of talking, but would love to see if there's anything I didn't address that you wanted me to address, or if folks have questions.
Absolutely. If you have a question, feel free to just open up your microphone and take the floor. I would like to just ask a little bit about the you shared those staggering statistics about the difference between health outcomes in our county. And I realize that probably there's not a simple answer for this, but I'm wondering if you might be able to address some of the things that you might be able to, in your role, shine a light on, or with other organizations, shine a light on that might change some of those outcomes over time. I also realized that I was involved as a volunteer with Bainbridge Prepares in giving out the vaccines. And after we started, it was a couple of weeks before we got a notice from the public health district wondering if we were capturing the race and ethnic data, which is sort of a it's sort of a hidden thing. It's like, oh, you know, we're not giving out vaccines based on ethnicity or race, so it didn't kind of come up as something that we should be gathering. But when you look at the figures that you were able to share, that's definitely, that data gathering is definitely a good way to judge whether you're making an impact or not. And if you don't ask, you can't tell. So if you might be able to address that question of sort of the ways that your position might over time be able to make a difference in those outcomes. I know it's a little guesswork now.
Yeah, so I think, Reed, I think part of it is just bringing a light to things. So while, you know, I shared data with you all, I do think I also need to bring, what I also need to bring up is the research that connects. So it was interesting because at last month's Kids at Public Health Board meeting, there was a community member who spoke, and it was interesting. They were very against, it sounded like, the declaration, but they made an interesting comment about, well, you guys are just showing us statistics, and statistics show you correlation and not causation. So, you know, so there's a connection, but it doesn't say that, you know, that racism causes poor health outcomes. But that's where research comes in, and that's where collecting and talking to our community members comes in. So I think that's a component that I really need to bring to light, because it's not enough for me to make comments like, you know, racism impacts health. So one of the things I need to do is, and that I'm working on, is a list of research studies, but then also, well, how can I help annotate that list so it's not like everyone has to read? Because while I find reading research studies interesting, they're not everybody's cup of tea. But I think helping to elevate people's stories, people who want to share their stories about their experiences, they need to be heard. And I think local folks need to hear this. Because again, I do think some folks say, not in my community, not in my county, this is not happening. And this is where elevating people's voices, people are already talking about this, bringing out the research. And my hope is at some point, Reed, is to have community conversations about this. Pie in the sky, what I would love to do is, I don't know if it's having a community forum on this, but this is where, you know, we could talk more about the declaration. We can talk about research studies. We can bring experts in. So it's not just me talking about, here's what I read in the book, or here's what I read in a journal. And also bringing organizations that are already working to address this issue, like the folks who run the Marvin Williams Center, for example. They do health events, and that while they serve everyone, a lot of the people they serve are people of color. So I think it's helping to bring people together and shining that awareness. Because I think we need to build awareness and empathy before we can really address the issues. And other things I can help with is also look at other, and actually when I talked with the Kingston Citizens Advisory Council last month, I think it was last month, someone brought up a really good suggestion about, hey, you know, you see that there's over 200 people, communities that have a racism as a public health crisis declaration. What happened as a result of that? So I think it's also bringing to light that how this declaration can really have an impact. And I think that's also where I can draw inspiration from. Starting a program can be very daunting, but I think also not having to reinvent things, looking at how other communities have done it, see if there's things that we can learn that way. So I think it's also bringing that into my presence. And so I don't have anything to share with you regarding that right now, but my hope next time I visit you all, I will be able to tell you what I've been able to accomplish, but I can also highlight, hey, here are how some other communities have handled this and what has happened, and not just looking at the big cities or the big counties, but counties that may kind of maybe more reflect our demographics as well. So I'm not sure if I addressed that adequately, Reed. So I think there are a lot of things. I love just thinking of ideas, but I also need to make sure that I, of course, run up chain of command, but also make sure that there are, that I respond to what community members are also interested in.
Yeah, I'm guessing that the, I'm guessing the American Public Health Association, which you were highlighting there, is going to be a resource for us, for you.
Oh, yeah.
to look at where those connections are being made and how we might be able to replicate them here.
Yes, and in our declaration, there was also mention of an organization called GARE, and I'm going to mess up the acronym, but I believe it's Government Alliance for Race and Equity, and they provide technical assistance to government organizations, training, and they also have a huge toolkit as well, and that's something that we're looking at joining. I think the city of Bainbridge Island actually beat us to it, and I think they've already joined, but that's another organization. So there are resources out there. It's a matter of looking at them and then figuring out what best suits our community. And your comment was really interesting, Reed, about collecting demographic data for vaccinations, because you're exactly right. We really want to figure out who are potentially missing when we do vaccinations, whether it's race, even age as well. But we also look at vaccination rates by area. So Bainbridge Island, for example, throughout the whole ever since we've had vaccine, has been one of the most highly vaccinated areas of our county, and has just done a tremendous job. But it also is a testament to groups like Bainbridge Prepares, the City of Bainbridge Island Fire Department, and the community pharmacy that have come together to do that. It's such an awesome operation that they have. But collecting data is important, so we know where the gaps are and where we might need to focus on, so we don't leave communities behind.
Venera, please turn on your microphone and ask away or comment away.
I wondered about, I'm interested in mental health and how public does deal with it. I don't know, you may have covered it.
It's a really interesting question. So we don't have a program or a department solely dedicated to mental health. I know that we have participated in different mental health related initiatives. I know when I started at the health district 13 years ago, we did, for example, have a suicide prevention coordinator. We also had a person with a mental health background in our parent-child health program, and that's a program that helps new parents, get the information and tools they need to help their babies grow. But unfortunately, with those programs no longer, or at least those no longer exist because of funding. So I think we do try our best to weave in mental health, but it's something that I think we do as a partner with others, like suicide prevention. I know we work really closely with the county on various things, but I don't have the. But it's definitely something, Venera, that I can also talk to our leadership about, because there might be something that I'm missing. But I think typically work as a partner and not necessarily a leader in addressing mental health issues.
I wondered about, since I'm talking about seniors, that we see people starting to fray at the edges, and we don't always know how to reach them. And we need to do that, because we kind of write them off as a Looney Tune at that point, and we don't really see progression of where you can step in. The average person, we are friends, we try to reach out, but what can I do with public health to help out?
It's a really interesting question, Venera, and I think one thing we could definitely use feedback on, and we've worked with organizations like the Kitsap County Division of Aging and Long-Term Care, but how do we get information out to individuals, especially individuals who might not use social media? I mean, you all are awesome using Zoom, but not everybody has internet access, computers, and whatnot. And so I think for us, it's even with this pandemic, it's how to best get information out to folks. We've partnered with organizations and asked organizations to get information out. But I think, moving forward, if y'all, I mean, Reed can also be a good resource for us in terms of getting information out, for example, to the senior center members. So I think hearing from our community members about how to best get information to them, but then also what questions and concerns do you have that we can address? We can't always have programs for every issue or problem, but we can definitely figure out, well, who is addressing those issues in the community? and then evaluate what our role is in that. So I think in terms of how individuals can help, giving us input on how we can get information out. Is there information that you think could be presented better? It's hard for us. I shouldn't say it's hard for us, but it's a challenge. It can be a challenge to communicate information to a wide variety of folks when different people have different ways of communicating, or certain ways we say things may be more relevant to like new parents versus retirees. So I think giving us feedback is a wonderful way. And you're also welcome to contact me if you have questions or suggestions, and I'm happy to see how I can get you the right resource. But also being aware, our governing board does meet monthly, and people are welcome to give public comment. In our public health board meetings, they're monthly. They typically are always the first Tuesday of the month. I forget what time, but those that's also is shared on social media. It's shared on VCAT, I think Wave Cable, and then the recordings are also on our website as well. So folks knowing what we do, I think, is, and with how the district does, and giving us input, I think is probably one of the best ways to work with us. And I hope, Vanera, I answered your question, and please let me know if I did.
Thank you. Thank you.
I went to an online conference last week about livable communities that was sponsored by the AARP, and there are communities that are dealing with this issue. There's also a person who talked from 8 to 80, which is an organization that is trying to encourage communities to think about how they could be accessible for people who are 8 and people who are 80. And if you're able to meet those two sort of age groups, you will get a lot of the challenges of disability or cognitive difficulties handled, because things that 8-year-olds need to understand, those of us when we are 88 and maybe fraying at the edges, as Vanera put it so well, probably could use a little more support trying to get through issues like public transit or mental health resources. And those are not always eminently clear. And I'm sure that also applies to people for whom English is not their first language, or concerns about their documentation status, and whether that would affect the kind of ways that they might go about trying to seek health support.
Thank you for that, Reed. And while we don't have a department or staff that look at whose sole job is to look at issues that affect our senior population, I mean, I think that's something that I can also help contribute actually at the health district. And when we talked earlier about reviewing our programs, policies, procedures, so I think that's also part of it, in terms of not just from a race lens, racial equity lens, but your 8 to 80, I think, is a really great way of seeing it. Is this program, that the services they're providing, are the benefits accessible to someone 8 to 80? So I think that's a really great way to look at it. So I will definitely take note of it, because that is one way that we should be looking at our services too, in terms of, for service, for example, I think even with public communication, how we typically get information out. So we have our social media, we have Facebook, we have our website, we work with our newspapers. But if you guys have others, if you'll have other suggestions on how we can get information out, maybe it's working, through, the senior center, also the city of Bainbridge Island. And I know that you'll have, is it the Interfaith Caregivers Group, and the name escapes me right now, but I've heard great things about them. If you can give us that kind of input, I think that'll be helpful too, because we definitely need to look at, with our communications, are there barriers, or are there people that we're missing that we need to address?
So that's the Island Volunteer Caregivers, IVC, ivcbainbridge.org. And your email contact is jessica.guidry, Guidry, at kitsappublichealth.org.
That's right. And Reed, when I send you my slides, I will also put my updated phone number. I decided just to go with the cell phone. Anyway, there's 360-509-0966.
We're just about out of time, but if anybody had one last comment or statement, Barbara?
Yeah, thank you. This was really fascinating, and I'm really impressed with your expertise and the energy that you're going to need for such a huge project. So really good luck. This is really important work you're doing. Thank you.
Thank you, Barbara.
I'm going to chime in on that too. I'm exhausted just thinking about your daily day. That would be absolutely bosom. But we are here to help you in any way we can. So stay in touch. And thank you.
And
Yes,
Marcy, can you unmute? I don't
Yeah,
know.
I'm trying to, I found it. I just wanted to tell you on the APHA, that you've been using. A neighbor at the beginning of the pandemic has been passing on her journals of the APHA that are wonderful. I would recommend anybody who can get a hold of that. And they have a lot of online, very interesting equity work that they've been doing. So I highly recommend them. So thank you for everything you're doing and will do.
Thank you.